we do PRF in socket, we don't close. I told you that now we are working with open wood. We don't open, we don't close, and we stay open. The sutures are only to fix and to stabilize the PRF. Tu peux le dire. C'est quoi ce problème? When you leave the PRF in the socket, what do we see first? We see the increase of the keratinization. And this is the main function of the open wound, is to give us more keratinized tissue. How to fill the socket? When we have a socket, we fill as much as possible. I told you this one, as much as possible. We put the first, and then we can go to place the second because we compact. Then we place the second plug. Then we compact again, and we go to place the third plug. Squeezing again. And then we go to try to place another plug. And when we try to place the fourth plug, we see that the socket is full. But you see that we put 4 cloths. We put 40 cc of blood in one socket. This is a very powerful feeling. We don't put just one. We fill. And when we say we fill, means we fill as much as possible. And if you follow this protocol, you will get a very nice ball formation and full ball formation into the socket. And the quality is very nice. When we put the PRF, we stay open, and then we see how much keratinized tissue we get. And when we open, we see the quality of the ball, and again, we will put PRF, and again, we will not close. Why? In order to get more and more keratinized tissue. This study was made in San Francisco, and I wanted to see and to compare PRF, blood clot, bone graft, and what is the conclusion? The first is that the greater loss is made when we put nothing into the. We know that. But when we put PRF in socket, it doesn't matter if it's PRF alone or PRF with bone graft. This is a huge message. We can achieve a good formation of bone only with PRF. Can we believe? Why? Because, and we will talk several times today, any protocol in medicine does not work all the time. The ratio is around 70% that you can trust in the technique. But when do we have to put bone graft in a socket? I can tell you when. When you are in the aesthetic zone, you cannot trust in PRF alone. Because it works, but not all the time. And when we are treating an extraction in the aesthetic zone, you must fill with bone graft in order to maintain the bone thickness, the rich thickness. So, but what is the quality when you use PRF alone? This is the best quality. Because as there is no foreign material in the socket, you get only bone with a full bone formation. Look at this huge cyst. We can fill with PRF alone. Look, only with PRF. And then look at the quality of the bone formation. The message I want to tell you, when you are in the posterior zone, you can use PRF. You can trust, even if the site is huge. When you are in the anterior zone, don't trust. It's not enough to guarantee, to give you the guarantee to maintain the rigid thickness. You see, extraction, only PRF, site open. Look at what happens. The gum is coming to close. And then look at the bone level and look at the crest thickness. A full vital bone. Why? Because there is no foreign material into the socket. Only fibrin will give you only bone. And this is why, when you use this technique, it will give you the best quality. What happens if we miss the buccal wall? We know that when we miss the buccal wall, we should put a bone graft. But look at the bone height and look at the bone thickness. We can achieve a good outcome only with PRF. But I need to show you, I need to explain you what is the surgical protocol. When we mix the buccal wall, we can achieve the formation in height and in thickness, only with fiber. But we can start to change some dogma. Dogma in periodontology is when you raise a flap, you induce bone loss. But I want to show you that even if you raise a flap, buccal and lingual, you can increase the region without any problem. What do? We use vessels. We promote the vessels, and the vessels, they will promote the bone formation. But in order to understand the surgical protocol, I need the whole day to explain to you what we should do. You will see. I will show you. But when we do socket preservation, we can use bone graft. What we will do, we will cover the bone with PRF, and then we leave open. This is the way. We use the open wound technique in order to make a simple surgery. Simple surgery means no closure. Because we know that in the posterior zone, in order to close, we need to stretch a lot. You see, filling the socket with bone, and then we leave open. Simple. Why? Because look at the soft tissue thickness here. Because look at the soft tissue here. Simply by making an open wound technique, we will increase the soft tissue thickness, and when we come back to reopen, we see that we have a very good bone formation here, and look at the reopen. But again, when we replace the implant, we will use the PRF again in order to improve and to increase the soft tissue thickness. Look at the outcome, final outcome, with enough quality. When we do a bone graft into the socket, it's very easy to achieve a closure with the PRF, because now we can make a patch, and the patch will be used to close. We use the patch to close the socket, and then we suture the patch to the gum. And then look at the quality. but it will be the first introduction of a new bone graft material that we will present to you very, very soon here in Vietnam. Because now we are changing a lot of concept in bone regeneration. When you have the teeth in this position, you know that it's impossible to close the side. But we don't care. Because the open wound technique will allow us to make a simple surgery. The most difficult is to close. We don't care about closure. Because now we do a lot of open wounds. We place an implant. We place a bone graft around the implant in order to maintain the bone thickness. But how to manage the soft tissue? We can close or we can use the poncho. Why the poncho? Because the poncho will help us to fill the gap between the implant, not and the bone, but between the implant and the soft tissue. And using this technique will allow us to get a very nice soft tissue. It's very easy. We don't need to make connective tissue graft. I told you that the osteonecrosis in patients with biphosphonate is coming because of the lack of KGF. This is a lady. She came back to the hospital because after 3 months there is no problem. She is starting osteonecrosis. Why she didn't close? Because she's getting biphosphonate. What is the solution? Just to clean and to put PRF. But again, don't make the mistake to try to close the site. PRF is here to give you the opportunity to leave open the site. Okay, my friend? What will happen? PRF will do the closure. Look, 1 week, 3 weeks, 3 months. It's very easy, it's very easy to close just with PRF. But why we do not the same at the day 1 when we do the extraction? And then I can tell you that even if your patient is taking biphosphonate, you have no risk. But there are 2 conditions: to fill with PRF, but to do not close the site. Because the closure will be so easier when you place the PRF in the open wound technique. When you have dry sockets, the best is to do PRF, to prevent, but also to treat. It reduces dramatically the amount of cases with dry sockets. Because PRF will help to induce vascularization. And then when you have a patient with dry sockets, just do PRF inside. Pain disappears only after 1 day. And the healing is obviously faster. When we do a sinus, we can use PRF in different indications. The first is to protect the Schneider by placing the membrane under the Schneider. But what is the best protocol? Is to fold the membrane. When you have a sinus and you want to place the membrane under the Schneider, please fold it. It will be easier because now the membrane has a smaller size but more rigid. And you see that here we have 2 membranes folded. When we have tears, the solution is to place PRF on the tears because PRF sticks immediately on the Schneider. And when you put the membrane, immediately you see the breathing because the repair is full. You have the breathing of the membrane because the membrane is totally repaired. When you place PRF on a hole, you see on the tear, immediately you see the breathing of the Schneider. It means that you continue your surgery. You don't stop. You continue what you planned to do. What is the best choice? PRF or collagen? Of course, we know the answer. There is no difference between PRF and collagen. But for me, there is a big difference. It's the cost of the procedure. Using PRF will cost much less than to use the collagen. Can we use a PRF to close the window, the body window? Of course. Again, we have the literature that shows that there is no difference between using the collagen and using a PRF method. Then obviously you understand that you will save a lot of money, getting the same outcome. But can we use PRF alone into the sinus? As a grafting material, like in the socket, of course. But we have one condition. It's to place the implant. Why? Because PRF cannot make the space maintenance. PRF, I showed you, shrinks. If you put PRF, it will not maintain the Schneiderian at the right position. If you want to use PRF alone, you must place the implant. In order to make the tenting, the space maintenance. This is the condition. And then, when you place the implant, how much time it takes to fill the sinus? It takes less than 20 seconds. Why? We just put the clots into the sinus. So easy and so fast. But you understand that we need to place the implant first. This is how we fill a sinus with PRF alone. So take your picture, my friend. Okay. So when we place PRF in the crystal technique, we don't need to put any bone graft material. When we place the implant and the PRF in the lateral technique, we do the tenting, we do the space maintenance, and then we fill the whole space with it, like in the socket. PRF is the best matrix that we can use in the body. When we have a double sinus, we can place the implant and then use only PRF technique. But the membrane will not be over because the implant is making the tenting. What is the quality? We publish already since a while. Again, when you use only fibrin, you will get a full vital book. 100% vital book because fibrin will give you only book. When we place the fibrin after implant placement, we can see how much time it stays. More than 16 years. More than 16 years. Stability. Why it's so stable? Because this is the best quality of bone. When we place the implants, and then we can see how much the bone is stable over time. Because fibrin will give you the best quality of bone. We have a very good stability. We have so many papers today in the literature showing that the PRF has sole grafting material is working very nice. Because we use a whole matrix, a fabric, and this fabric will give us. See? Sometimes we do the sinus and we remove the body window. And then if we want to place it again, you understand that it will fall inside. This is why we put it vertical. With this position, the body window is stable, you see here, here, and then we don't have the collapse of the soft tissue inside. What is the amount? We need at least 2 membranes under the Schneider because we want to protect the Schneider. We will put 1 to 2 membranes for the window closure. We will put 2 to 4 maybe with biomaterial or with sticky glue. I'm talking about the amount of tubes. And we didn't ask yet. Some material if we have tears. And you understand that when we start sinus, sorry, we need at least 8 tubes. At least 8 tubes for one sinus. When you do an extraction, and you see that you have a communication with the sinus, how to manage? Very simply. You manage as an extraction. Don't close. Don't try to close the soft tissue. Manage it as an extraction. Simple. Even if you have a big hole into the apex, and you will see that it is perfect. When we do extraction and we want to make an immediate loading, okay, what do? We put bone graft, and then the question is how to manage the soft tissue. It's better to use a poncho. Why? Because it's simple, easy, and then we can place the provisory. The healing is fast and perfect. But if we want to see inside, we see that we have already the full gum. In 1 week, PRF will give you the soft tissue to close the side, and then to achieve a good aesthetic outcome. Another case, look, extraction, implant, bone graft, poncho, and then we place the provisory. The PRF, the fabric outside will disappear, but look at the outcome, how it's easy, simple to achieve a very nice feel. No suture, nothing. Again, extraction in the aesthetic zone, graft, poncho, and look at the new soft tissue. Simple procedure, fast procedure, but the best outcome means look at the quality of the aesthetic results. We need to talk about liquid. The PRF, what we said, the PRF contains a very high amount of stem cells. And then the stem cells, we will use them for what? To go to inject the gum in order to regenerate the gum. In this case, we have a missing papilla. We can make a surgery, or we can go to inject stem cells. How to inject the stem cells? We don't inject the stem cells into the papilla. We never do that. We inject the stem cells because we go through the papilla and we go to the bone contact. And then we inject the PRF. We don't inject the papilla itself because papilla is very strong. We inject in the periurethrum over the papilla. And then we can inject at least 1 cc or maybe more. And what happens when we inject the stem cells into the periurethrum? We can rebuild the papilla. See? And you see how it's easy and fast. We can inject again the papilla. Look how we can improve the volume of the papilla. We have different, this picture are not very good, but it's a publication recently done in 2022. But look at how we can increase the volume of the papilla. Just by injection, but the technique is very simple. Go through the papilla to the bone contact, and then you can inject. We can use the PRF for the TMJ, because when they have pain, the best treatment is to inject the PRF into the TMJ. It's so easy because you see where we do line between the tragus and the angle of the eye. And then 1 centimeter above the tragus, you have the site. It's very easy. You see, you can trace the line, and 1 centimeter above the tragus, you have the site of injection. But you need to ask the patient to open wide the mouth. First, doing a very small anesthesia, local, and with the same needle, we will go inside. You see, open mouth, mandatory. Just to show you what we do with the PRF again. This is a liquid, but the liquid is more rich. And we use the PRF because we have today publication showing that PRF is much better than PRP. And we can compare the quality of the cartilage regeneration with PRF. We do in knee arthritis. This is my daily practice. In my pain clinic, I inject a lot of joints because the pain of the joints is not coming from the cartilage damage. The pain of the joint is coming from the inflammation of the synovium. Okay? This is a dentist. He got surgery in the knee, and 6 months after he's still with pain. Then we started to inject his knee monthly, 1 injection in a month, and then we can see after 2 injections how he's broken down. Okay? And at the end, showing me how he's running in his life. Simply. This is what I do in my daily practice. I inject stem cells to regenerate bone, even when we have a missing healing in pseudarthrosis. We can inject to regenerate a crack in the cartilage. This lady came for a dental because you see that she's needing implants in order to regenerate the maxilla. But the dentist was using also PRF for skin. And this is how the lady was after both implants and skin treatment with PRF. We can regenerate all the tissues, the cartilage, the gut, but also the skin. And this is what we do today. When we treat with PRF, you see we can regenerate the skin, and then it's like a lift. We can treat the dark circles. We can treat the acne scars. Because when we do PRF, we can regenerate a new skin. Using the microneedling, you see, and look at the new skin with PRF. And you see that we put PRF on the skin. We don't need to inject. We do the microneedling just by putting PRF on the skin. This is another treatment. All these treatments are made by dentists because now dentists all over the world, they are starting to make facial aesthetics. Because they do aesthetics of the teeth and they do aesthetic around the teeth. We can treat hair also in order to improve and to stop the hair loss. Again, we can regenerate something in the scalp with the stem cells from PRF. And this is what a lot of teams are doing all over the world, is to help the people to get more hair. There is one question. Should we charge? When the patient is coming to you, so should you charge the PRF? Of course, yes. PRF is not for free. If you replace bone graft by PRF, the price for the patient is the same. If you replace a membrane, a collagen, by PRF, the price is the same. But what I want to give you as a message, when you use PRF and you want to give it for free, it's not. But the patient must know the value. You put the price and then you say, I give you this discount. But the patient must know the value of PRF. And the value of PRF is at least the amount of the bone graft and the collagen that you should use in the socket. So, I was talking during 2 hours and a half on the benefit. But if I want to talk about the failures, I will need 5 hours. And this is what we will show from now to the end. We will talk only on failures because we learn more from the failures than from the success. We have failures in osseointegration, after osseointegration, after bone graft. Is it a fatality to lose the bone? No. We need to understand. But if we want to understand, we need to ask the question. Why? Why the graft is not a success? Why the implant is not a success? But what is the main question? We do 2 surgeries. Same surgery, same patient, same materials. But we don't have the same outcome. If we go to the literature, we don't have good answers. We don't have clear answers. From Albrechtson, from Tano, maybe multitude of factors. Then we need to go back to the science, not to the literature, only to the science. Bone healing depends on the site. If tomorrow you are on your bicycle and you break your tibia, How much time it will take to heal? 6 weeks. 6 weeks for your teeth. And then you can walk again. And if you make a graft into the socket or into the mouth, it will take much more. Much. Why? Again, we need to go back to the science. (1596). Cabrol is the surgeon of the king in France. And he is the first to publish osteology, the science of the bone. Talking about the communication between the bone cells, but this science will stop in 2000. Why it stops in 2000? Because in 2000 it was the first publication of osteoimmunology from Aaron and Charles, explaining the communication between the cells through the immune system. What is osteoimmunology? The osseointegration starts by an immune reaction. Inflammation is an immune reaction. And inflammation is made by the cytokines coming from the white cells. Immune cells contribute to the early stage of angiogenesis. It means that the amount of vessels, the amount of new vessels that you get depends on the immune system. Immune cells are factors, and immune factors are the key regulators of the wound. If you want to heal, you need the help of your immune system. This is a huge change, but it's not finished. Immune system plays an important role in the bone formation because it activates the osteoblast. And the immune system regulates the bone resorption. Yeah. How it regulates? Because when you have an immune deficiency, it's like you have osteoclast free to work and to eat the bone and to resorb the bone. It means that the immune system is here to stop the osteoclast activity. It's a huge change in our knowledge of bone. But what is the immune system? Immune system is made by cells, all the white cells. Neutrophils, macrophages, lymphocytes. We have proteins into the immune system, interleukins, antibodies, TNF. And what is the immune reaction? The immune reaction is the inflammation. But maybe you miss the most important information about the inflammation. This inflammation must be brief, maximum of 5 days, maximum. Because during the first period, from the beginning to the 5th day, we have the short-term inflammation, which is always beneficial. Yeah, we know that we need inflammation to heal and to recover, but it must stop at the 5th day. If the inflammation persists, then it becomes harmful. Because the effect is inverse, it's not beneficial. It's harmful. Yeah. The healing is
made in 5 days only. You must heal in 5 days. You must achieve the healing in 5 days. Why the long-term inflammation is harmful? Because it induces production of free radicals. We name them oxidants, unstable, toxic. What is the reaction from the body? The reaction from the body is to produce antioxidants. Then you have the second information of the day. If you want to reduce the inflammation, you can do it only with antioxidants. But the long-term inflammation also induces differentiation of macrophage in osteoclast. When you have too much inflammation, you will have a lot of resorption because of activation of osteoclast. So now you understand that we need to be in a balance between both oxidant and antioxidant. But sometimes we produce too much oxidant, or we don't produce enough antioxidant. And we name the situation oxidative stress. Don't forget this term, because it's a key of the understanding of what happens after the surgery. Oxidative stress leads to major cells issues. DNA, membranes, immune cells are damaged. And then the wound healing is delayed. And if the wound healing is delayed, means more than 5 days, you will get more complications, more failures. When the oxidative stress damages immune cells, then we have a deficient immunity. What is the situation with deficient immunity? Osteoclasts are activated, osteoblasts are inhibited, leading to the failure of the root. My friends, I want to be clear today. Very clear. You lose the bone because you don't remodel the bone. Bone doesn't resorb like an ice cream under the sun. You put the ice cream, bone resorb because it's not remodeled. It's the only one mechanism. I can show you. And then when you have any kind of complication, you have only one explanation. Too much oxygen. Related to a high level of inflammation. Any kind of issue is related to an excess of oxidant production. We know that the diabetics and smokers, they have issues in wound healing. Why? Simply, they produce too much oxidant. Simple. This is why they don't heal. This is why they are meeting too much complication. Just to give you more details, diabetics. This is a chronic inflammatory disease. Hyperglycemia induces oxidative stress, and diabetics are deficient in vitamin D. What is the issue with the smoke? Smokers, they have one issue. It's the smoke. Why you are not allowed to smoke in the restaurant? Why you are not allowed to smoke here? because the smoke will kill the antioxidant. Of all the tissue in contact with the smoke, the gut, the lung, the skin. This is why we cannot smoke in a restaurant. Because my smoke of my cigarette will kill the antioxidant of my friend. But, sorry, smokers, they are deficient very good. For us now, it's very clear. Very simple to explain. When we have a long-term inflammation, we will meet oxidation. And when we have oxidation, we will have deficient immunity. Then, easy to have more infection. Immune system is not good. Then, easy to understand why we lose the bone. And easy to understand why we meet fibrointegration. High level of inflammation induces fibrosis. And I want to tell you and to remind you, at the beginning of the COVID, if you remember, we did not have the PCR to make diagnosis. How to make the diagnosis of COVID? By making a CT of the lung. Looking about fibrosis. High level of inflammation, remember, cytokine storm. Induce fibrosis. Then, when you have a fibrointegration of your implant, when you have a fibrointegration of your bone graft, it's because you got too much inflammation around. Too much inflammation into the bone. Fibrosis does not occur by chance. Fibrosis occurs by long-term inflammation. Bone loss, I want to give you just a simple example. You do extraction, and then there is a lack of mechanical activity. When the bone does not work, the bone produces too much oxidant. And then you have oxidation of the ridge, leading to the resorption of the ridge. The ridge resorbs because of the oxidation of the bone again. We can talk about the origins. Too much oxidant means also not enough antioxidant, or too much oxidant. We will analyze all this. First is the biologic condition. When the patient is coming to you, you make the examination. Do you smoke? Do you have diabetes? Do you have allergy? This is not the good way to make the examination. The good way is to try to see if there is an oxidative stress. And how to assess the oxidative stress in pre-op? We have blood markers. We can assess the oxidative stress by making a blood test. What are the markers in the blood? The cholesterol and the vitamins. We have. Then, this is what we should do. And I published already, almost 10 years ago, this paper to inform the dentist that they need to take care about the cholesterol and vitamin D in pre-op. It's not now, it's 10 years ago. What is the issue? Cholesterol. We know the cholesterol. We know that we have two kinds of cholesterol. The good and the bad. The good one is the HDL. But why it's good? And And this is what you will learn. Everything good in the biology is antibiotic. And why the LDL is not good? Because it's an oxidant. This is the biology. Everything good is antioxidant. And then when you have too much cholesterol, you will meet oxidation of the osteoblasts. And we know what happens when the osteoblasts are oxidized. It's the critical component of the physiopathology of bone. You lose the bone again, and then repeat because oxidation of the osteoblast. If the cholesterol is over 1.5, 1.4, you will have a delayed osseointegration. If the LDL cholesterol is over 1.8, even in dream, you will not meet osseointegration. Yeah, but when you don't make bone, what the cells they produce fat. And the bone becomes to be yellow. When you raise the flap, your bone has a yellowish color. Because the bone is fatty. What was the position of Varma more than 35 years ago? He was teaching the students. When I see a yellow bone, I cancel the class. Why, Professor? I don't know why. What I know, I have too much pain. Then, if I raise the flap and I see a yellow bone, I do not. Because we will have too much issues. But today, we can explain. The yellow bone is coming after high cholesterol. Yellow bone is coming after oxidation of the bone. We have to take care about the vitamin D, because the vitamin D is very easy to understand. We have two kinds of pathways. The first is through the liver and the kidney. And this pathway is to produce an hormone. Vitamin D is an hormone controlling the metabolism of the calcium. But we have another pathway. Through all the cells, the vitamin D induces production of antioxidants. Wow, this is interesting. What does it mean? It means that today we are more interested about vitamin D, not because of the calcium metabolism, but because of the immune function. We use the vitamin D as an immune stimulant, and the COVID was a good opportunity to test. During the COVID, we saw that there are some people very fragile and people dying from the COVID. Diabetics, obese, smokers, dark skin. You know that in US, more than 50% of people dying from the COVID were Afro-American, black skin. Why? All these people, they have one thing in common. They are in oxidative stress. But we know that in oxidative stress, we have a deficient immunity. And then if your immunity is deficient, COVID will kill you. Simple. The minimum of vitamin D is 30 nanogram. Minimum. Insufficiency is between 10 and 13. 20, and below 10, it's a deficiency. However, the majority of the population is deficient of the majority. But why? Why so many people are deficient? Because we don't live as planned in the beginning. At the beginning, all the people that were living naked without clothes. Yeah. This is how the humans started in this earth. And today, the modern human, where is the skin exposed to the sun? There is no skin. We live in buildings, and when we go out the building, we take a car. Means we never take enough sun. And then, in this room, I can tell you that 80% of the people here are deficient. More, maybe. That you understand that people deficient, they don't produce enough antioxidants. What does it mean? They don't have a good immune system. It means the bone is not growing easily. We know people that are systematically deficient. Elderly, dark skin. Why they don't produce enough? Because of the melanin. The sun is not going through the skin, then they don't produce vitamin D, even if they go to the sun. Diabetics, smokers, obese. And when you lose the bone, the first action that you should do is to ask for a lab test. Why the patient is losing the bone? Because the patient cannot make the remodeling. The bone resorbs because of the immune deficiency. And look at the vitamin D and look at the cholesterol. When you lose the bone, it's not a surprise. Biology is not good. And when the biology is not good, the bone is not stable. You can maintain the bone because your immune system is working well. No immunity, no bone stability. Look at this paper, published recently. Vitamin D deficiency has a causative role in the systemic inflammation. Below 20 nanogram, you have always high level of inflammation. High level of inflammation means bone is not working well. Too much oxygen. I'm getting a lot of emails from people. Hey, I've got 2 successive failures in osseointegration. Of course, my friend, your patient has not good biology. Your patient has not good biology. Your patient is losing all the implants because the biology is not good. And you understand that today we are not talking on titanium quality. We are not talking on any kind of local. We are talking on biology. If you lose the bone, it's because you don't produce enough antioxidants. Because you have too much oxidant. And then the bone stability is impossible to achieve. What is the protocol? Because we started to publish and we update all the time. We never do a surgery without testing. No way. No way. I want to know how is my patient. I want to know how is its immunity level. But when we test, we never find too much people with the right level. What is the right level? It's not 30, it's at least 50 nanogram. It means that if you test all the people, and all the people are below 50, means we supplement all the people. It's easy to ask, if you supplement all the people, why to test? My friends, you must understand that we need to give to the patient a very clear answer. When you make a test, you have a paper. And in the paper is the level. And you say to the patient, look how you are. You are deficient. And the deficiency, you will lose the blood around you. And this is why I will give you vitamin D today for a few months, but after you need to continue the supplementation for the whole life. Why they are deficient today? Because of their lifestyle. Next year, they will be deficient. Next 10 years, they will stay deficient. What is important in the test? The important is to say to the patient, look, you see how you are? If you don't supplement yourself, you will lose the implant. But it will be your fault, not mine. And you will pay again. When they lose the implant because of their biology, it's not your fault. And this is why we test all the people, and this is why we supplement all the people. Because we need to give them the information that bone stability is coming from the immune system, and if they are deficient in vitamin D, maybe they will lose it. It's not my fault. I gave you the information, you do what you want. You want to supplement, to follow, okay. You don't want, you will lose it. And then you will come back with the implant in the head. This is the information that we need to give to the patient. But if you want to give them the right information, the paper is important. What is the level of supplementation? Usually when we go to the official website of government, Vietnam, France is the same. They say 400 to 600 units a day. Okay. But what is the action of this protocol? This protocol is to prevent skeletal abnormalities. But now we don't want only skeletal, we want immunity. We want to improve the immune system. And if we want to improve the immune system, we need to give them 10 to 20 times more. I will repeat. 10 to 20 times more dose of vitamin. Why we give this dose? Because we want to achieve a high level of serum, 50 to 70 nanogram. And then you will say, oh my God, it's too much. No, it's not. It's normal in human physiology. But I need to explain you what is normal in human physiology. Look, I want to ask you to make a common experience together. Tomorrow, we go to the beach, all of us. We remove all the clothes. We will stay the whole day naked.
It's not possible in Vietnam.
No, we are not in Vietnam. We are in a secret island. in the secretary, nobody's looking at it. But what do we want to do? We want to make an experience to stay the whole day under the sun, and at the end of the day, we make a blood test. How much vitamin D we produced? And you will see that you produce 20,000 units in 1 day. If you stay on the sun, you can produce 20,000. And then, if I give you 10, is it dangerous? No. It's less that you can produce in 1 day. This is why we say 10,000 is normal in human physiology, because a human can produce 20,000 by himself. This is a baby. This is Leo, and I'm grandfather since a few months. How much he's taking every day? 2,000. 4 kilo, 2,000. What is the message? It's not my prescription. The message is, you want to increase the immune system? Increase the vitamin. Even a baby can take 2,000 in a day. When to start? We may start at least 1 week before the surgery, because we need to stimulate the whole factory of antioxidants that we have. When the patient is deficient, he needs time to have an efficient factory of antioxidants. 1 week minimum. And then we have 2 kinds of patients. Patient without risk means normal patient. And we have risky patient, diabetics, smokers, all the inflammatory situation that we have. Normal patient is 2,000 to 4,000 units a day, minimum. Risky patient, we will give them 5 to 10. But you understand that we did first a test, and then we adapt the amount to the level, to the serum level. But after 3 months, we will not stop the supplementation. We will say to the patient, now you start a new life. It will be done with your medical doctor. It's not the dentist who can organize, who needs to organize. No, you give the message. Now, you talk with your doctor and he organizes the supplementation for the whole life. My friend, you understood that we need to test in order to supplement. We have a chronic inflammatory disease, diabetics, obese people, all the inflammatory disease, they induce oxidation. They induce oxidative stress, and there's people that will have issues in bone formation. And also, they will have more complications. We need to talk about long-term inflammation. People allergic to penicillin, we know what happens. These patients are very difficult because they have an increased risk of infection. They have an increased risk of failure of implants. Why? Because first, allergy is an immune disease. Allergy is an immune pathology. And we know the response, the T. And this T lymphocyte is releasing a lot of inflammatory cytokines. And we know what happens when we have too much inflammatory cytokines. We have oxidant production. But allergic, they have also another issue. They are deficient in vitamins. And this is a new position for you, a new information. All allergic are deficient in vitamins. And then they don't produce enough antibodies. And then the conclusion is what? They are in oxidative stress, and this is why they are getting more infection and failures. You understand that today we explain everything with the immunology. We do a bone graft, and after, when we re-enter, we meet fibrosis and resorption. Why? Very simple. We do an augmentation, and this gum here is not enough bacteria poof. And when the soft tissue is thin, when the soft tissue is deficient, then the bacteria, they penetrate. They move into the gum, inducing chronic inflammation of the gum. But we know what happens when we have a chronic inflammation. Cytokines release. Cytokine all the time. And then it's easy to understand why we are getting resorption and fibrosis. You now identify one of the main origins of resorption. One of the main origins of resorption is the soft tissue. Because when the soft tissue is inflammatory, the soft tissue induces resorption on the underlying bone. When you lose the bone around the screw here, it's because of the inflammation of the soft tissue. You can make a very nice augmentation with autogenous bone. If the soft tissue is inflammatory, soft tissue will induce resorption. This is new understanding. It's not from the material itself, it's coming from the soft tissue. Then, we would like to build a strategy in order to have a good immune system. What is the strategy? The strategy is to have an effective immunity. You want to meet the goal of bone formation? Only the immune system will give you this possibility. How to improve the immune system? We know the vitamin D. Why we want to improve? In order to reduce, to shorten the inflammation. Remember 5 days. We have also the possibility to make more than vitamin D, to give to the patient a lot of supplement in order to produce more antioxidants. This is what I designed during the COVID lockdown. I understood that sometimes we need to help the immune system. And in order to help the immune system, vitamin D is good, but sometimes it's not enough. We need more. But we need more to do what? We need more to produce more antioxidants. Again, we can propose to the patient the autophagy. Who knows what is autophagy? Yes? Nobody knows what is autophagy? Interesting. autophagy was designed by Ozumi. And he got the Nobel Prize in 2016. What is autophagy? Autophagy is when a cell is in fasting, the cells organize its own cleaning. If you stop to eat, the cells are going to clean and to remove all the unwanted substance, including oxidant. It means that when you are in fasting, you make a detox. Today, we have a huge evidence about the immune function of autophagy. When you stop to eat, you improve your immune system. Good. Dentists, when we talk about autophagy, they say, where is the shop? Where to buy? Because dentists are in use to buy. You don't need to buy, my friend. You just need to induce. And how to induce autophagy? By intermittent fasting. Intermittent fasting is from 8 p.m. to noon. Oh my God. We don't eat from 8 p.m. to noon? No. It's so easy. Just miss the breakfast. Let's see. If you miss the breakfast, you fast from 8 to noon. You save money and you improve your immune system. And today we are testing different protocols, and this is my best protocol today. When we want to make a surgery, we ask the patient to start an intermittent fasting. 5 days before and 5 days after. That's it. We ask them just to do not take a breakfast during this 10 days. We are getting much better wound healing. You will be surprised to see how they heal fast because they have a better immune system. But what is the second surprise? Is that after the testing, 70%, 70 of the patient, they say, we continue. We feel much better. Then we follow the concept of the intermittent fasting. We will present the first outcomes in the next Congress in Nice in June that I organize every 3 years. Should we use cortisol? Definitely yes. Why cortisol is beneficial? Because cortisol shortens the inflammation. It doesn't stop the inflammation. Cortisol reduces the time of it. And then it's beneficial. But we don't need to use different days of cortisol. Only one dose. Only one single dose is enough. In pre-op, it's 1 hour before. Prednisolone of 1 milligram per kilo, or if you want to inject dexamethasone 0.2 milligram per kilo. One shot is enough. One shot. 1 hour before the surgery. Should we use antibiotics with immune function? This is a good question. Until today, you never asked the question. But now, you are aware about the immune system. Kudo, published 40 years ago. paper about immune function of macrolides. During the COVID, I believe that you saw that we were using a lot of antibiotics. We can ask the question, why to use antibiotics? COVID is a virus. And we know that viruses are not sensible from the antibiotics. Then the question, why do they use azithromycin? From my side, I said they use azithromycin because azithromycin has an immune function. And you see how we must make the reflection. And I said, after the lockdown, immediately I will start to test and to see how it works. Fortunately, just after the lockdown, we did a surgery in a patient with allergy to penicillin. Then we used the spiramycin. We did the bone augmentation, and the patient came back after 1 week with a monumental infection. A lot of pus, a lot of swelling, pain. And then the surgeon called me to get an advice. What should we do? I said, not much. Just give to the patient azithromycin. 3 pills, 3 capsules today, and 3 capsules tomorrow. And we will see after 2 days what happens. Please give him vitamin, a big dose in order to help the immune system. And the surprise was that after 2 days, the abscess was gone. 2 days only. And after 1 week, the patient showed a full recovery. Amazing. This is the first time in my life that I see an abscess going on spontaneously. An abscess, I learned from 50 years that we need to open, to clean, and then maybe we can expect a healing. But the second surprise was to see how was the bone graft after 3 months. Full surprise. It was a huge abscess, and it was a big success. It's unbelievable. And you understand that today, when we work on immunity, we work differently. We changed all what we do. And the publication, they came only after August 2020. The first paper was published in 2020, August. By who? By an endodontist. The first publication about the immune function of azithromycin was published by a dentist. Good. And then we got successive publication about showing that azithromycin can inhibit oxidative stress. This is a huge message, huge. But what is the pharmacology of azithromycin? Azithromycin is active on anaerobe and anaerobes. Azithromycin concentrates itself in the soft tissue. And azithromycin, only 1 dose is enough. You don't need to give them all the week. You need to give 1. And it works for 1 week. It's unbelievable. This is a new concept of antibiotic prophylaxis. Usually we give them every day. Yes or not? Morning, evening, and more, very often they stop to take after 2, 3, 4 days. Today, we can give them only one dose. And this is my protocol. I designed at the beginning. But you understand that the protocol starts with an immune supplementation. We are not using an antibiotics, we are using an immune. The first is to increase the defense. Vitamin D or intermittent fasting or what you do. And then, what do we do? When we make a simple surgery, simple implant, simple GPR, we give them one dose of azithromycin, one. That's it. That's it. Finish. The day before, the night before, we give them 1 drop. But sometimes we do big augmentation. And when we do big augmentation, we give them 2 single doses. One is azithromycin the night before, and one is amoxicillin 1 hour before. That's it. We don't need to give them 1 week. It's for us. It doesn't serve to anything. But you remember what I told you a few minutes ago. The gum, the quality of the gum will be the condition of the success. And when you have a patient with a thin biotype, when you have a patient with an inflammatory soft tissue, we will give them a weekly treatment with azithromycin during 1 month. Because azithromycin concentrates itself into the gut. And then we will prevent the resorption. We will prevent the infection of the bone. What the gum loves most. Azithromycin on the teeth. This is the best that the gum loves. The best. Because I told you that the azithromycin concentrates into the gum, but if you put azithromycin just under the periosteum, it moves to the gum. But how to prepare the powder? Where to find the powder of azithromycin? It's very simple. You go to the pharmacy and you ask for azithromycin for kids. And what is azithromycin for kids? It's a bottle of powder. And then, easy to put a little bit powder under the soft tissue. Very, very simple. Good. But when the patient is allergic to penicillin, yes, we can use azithromycin, but take care. Azithromycin is not enough. You need to improve the immune system. All allergic patients must be supplemented, at least with vitamin D. This is a gum after 4 days. What do we see? We see that there is not still any inflammation. Yes, the objective is to have no inflammation at the 5th day. This is the objective of our protocols. When we treat the patient, look at the inflammation before the extraction. We did implant, bone graft, we did the whole treatment. and this is after 3 days. What do we see after 3 days? No inflammation. It's good. We must stop before the 50th. Look at this soft tissue after 5 days. It's unbelievable. We never saw the soft tissue like that before. This is the full protocol of immune stimulation. Look at the soft tissue after augmentation in a month. Look at the soft tissue after 5 days or 6. This is new. We never saw that before. Today, when we improve the immune system, we can get a better, much better healing speed. Inflammation is coming from contamination. When you open the gum, when you make an incision, immediately the bacteria leave. And immediately when the bacteria are in, you induce inflammation and swelling. When we do a CT scan after 1 week, what do we see into the sinus? We see bubbles of gas. Who produces gas? Anaerobic bacteria. It means that when we do a surgery, all the surgeries are contaminated by the bacteria of the mouth. And then we understand why, after making a sinus elevation, we can see non-homogeneous bone graft because of contamination. How to help the contamination into the sinus? It will not be with azithromycin, because azithromycin target is the soft tissue. Then we will use the metronidazole. Metronidazole, we know that this molecule is very active on anaerobic bacteria. And this, look, I published 20 years ago my first paper on metronidazole. Putting the powder into the bowl, a little bit dose, just to show you what we saw when we started. This is a bilateral sinus. One was treated with metronidazole, mixing metronidazole with the bone graft and the control. Look at the behavior. No metronidazole, huge inflammation into the sinus. We know that the inflammation was stopped after 5 days. Otherwise, the bone formation is delayed. Too much inflammation, too much oxidation, less bone formation. And this is why sinus, we will mix the bone with metronidazole. 50 to 100 milligram is enough. But now you take a capsule and you crush it in order to produce a powder. So now my friend asked me to stop. Usually I never stop. No, because people, they say, no, we do intermittent fasting, we want to improve our immune system, then we don't eat.
Alo. Alo. Việc làm cá nhân